of federal relief. They're unable to access unemployment insurance, but also the way that the rules got written around the federal relief checks, people who filed taxes but filed with an individual taxpayer identification number, which is the main way that undocumented people pay federal income taxes, are ineligible to get a federal relief check. More than that, if they're in a family where it was a married couple filed jointly, one of them was a U.S. citizen filed with a Social Security number, another undocumented filing without a Social Security number but with an ITIN, that entire couple and their children are frozen out of the federal relief checks, and that's a particular import in Los Angeles in the numbers we'll see in just a second. Next slide. What's important to realize is that this is not a population that is, as I mentioned, it's a pretty big share of the population, and partly because living with so many U.S.-born family members, particularly children. One of the reasons for this is it's a very long settled population. 70% of undocumented Angelenos have been in the country for longer than a decade. That, by the way, is higher than the state of California, where it's about 2/3 of undocumented Californians have been in the country for a decade or longer. But it's really important to realize this is a deeply entrenched, deeply embedded, deeply engaged part of the Los Angeles community that's being frozen out of most relief and is also heavily impacted by the collapse in certain kinds of industries. Year over year, from last May to this May, there's been almost no change in the employment levels in high tech and finance. But meanwhile, in leisure and hospitality, where lots of black and brown workers are, there's been a collapse of employment by about 50%. So significant economic impacts. Next slide. This is a bunch of data that we will provide to you, so I won't spend a lot of time on this chart. The two things to kind of take away is that Los Angeles County, which has about a quarter of the state's residents, has about a third of the state's undocumented residents. The city of Los Angeles, which has only about 10% of the state's residents, has 17% of the undocumented residents. So this is very important to us. And if you go to the last line, you'll see that number 199,000, kind of the second number over where there are numbers. There's nearly 200,000 children living in families with married couples as their parents, where one is undocumented and the other is either a green card holder or a U.S. citizen. Exactly that set of children being cut out of the federal relief checks. Next slide. Another really significant thing for children has been, what does it mean when Los Angeles City and County went to remote learning? For many of us who went to remote work or remote learning, we might be comfortably ensconced in our own place with high-speed internet and a computer. And in fact, the definition in the literature of being digitally connected is having both of those things, a computer or laptop and a high-speed internet in the household. You could see from this data that when the schools were shut and sent home their K-12 students, only about 13% of white students went back to homes where there was not both high-speed internet and a computer. But 35% of black kids, 39% of Latino kids, 36% of Pacific Islanders, and 36% of Native Americans. It's important to realize that Los Angeles County has the largest urban Indian population in the country, went home to homes that are on the wrong side of the digital divide. And that means that the sort of gap in learning that we're expecting from people having to do remote learning rather than being able to be in the classroom, the way that that's setting people behind has a very significant racial disparity component to it as well. Next slide. There's also an issue if you're trying to learn at home of going home to a condition where the house is very overcrowded. And as you can see, that's significantly higher for black children, about 2.5 times as high as it is for white children. But the group that affects the most is Latino children, where overcrowded households are households defined as being 1.5 persons per room. Those are conditions that make it very difficult to learn. Those are also conditions that contribute to the challenges of maintaining a household without passing on infections between household members, and it helps to explain a little bit of the case data and certainly some of the death data that we looked at. Next slide. This shows you that this pattern of overcrowded households does have a geographic pattern. The levels of overcrowding are actually the highest in South Los Angeles, particularly in the band of South Los Angeles that's represented by Councilman Price's district. Also in Long Beach and parts of the eastern San Fernando Valley, where Council President Martinez is the representative. So these are conditions deeply affecting many districts, and actually everyone in Los Angeles, but they do have particular impacts in particular districts. Next slide. This just shows you where the severely rent-burdened households are. Big problem in South Los Angeles, Northeast LA, actually, and Long Beach. And I believe the next slide might be the final slide. Which is something that's very, very familiar to you on the council who've been working on this issue with great energy, is that another big part of what the COVID crisis has made very clear to us is the issue of homelessness, but also importantly, the racial disparity in homelessness. Black Angelenos are about 9% of the county's population, but about 40% of the county's homeless population. So big issue, and one of the things to be taking a look at with Project Roomkey, which was a very creative response, is it seems to have disproportionately been effective with and reaching white folks who are homeless, not as much with black folks who are homeless, and that's an issue to be taking a look at in the implementation. Last slide on my part. All of this is complicated by the patterns of air pollution. This is looking at health risk from air pollution. This has been associated in recent studies with COVID cases as well. And you can see here that the air quality that leads to health hazards is very pronounced in South LA, Southeast cities, East LA, kind of heading down the San Gabriel Valley. One of the things that we've been trying to say about the COVID crisis is that the disease of COVID has revealed some of our sickness as a society. The precarity of employment, the nature of homelessness, the problems with legal status, and that the recent events around policing, in particular the murder of George Floyd, have made us aware of structural racism, but that bad policing is only the tip of a racist iceberg that has all sorts of levels around educational inequality, economic inequality, and environmental inequality. And you could see from this presentation that economic inequality, that environmental inequality, that educational disparity are part of the landscape of Los Angeles and the conditions under which we need to try to address things. So let me turn things over to my good colleague, John Kim.
Thank you. So in my nightmares, I'm having to always follow Dr. Pastor in presenting, so thank you for setting that up for me. I appreciate the council for creating this space. Thank you, President Martinez, for doing so. It's good to see you again. We saw briefly last week, as well as Councilmember Weston. It was good to see you at City Hall last week. The work I'm about to show you, we actually started working on this several weeks into the crisis, right? So we started thinking about this in March, and we did this because we understood that the economic and political and geographic topography of this place, the topography of LA, always shifts burdens directly towards Black and Indigenous and people of color, while elevating the benefits to wealthier and wider communities. That was our assumption, and we've seen it time and time again. But with COVID-19, we didn't think it'd be anything different, so we started doing the tracking of confirmed cases. And, you know, the caseloads were not tagged with race for a very long time, and there's still not nearly enough of the cases tagged with race. So we had to create a new methodology to look at the neighborhoods and the demographics of those neighborhoods. And, you know, the LA Times actually just replicated our analysis on this. did not refute it. DPH and DHS did not refute it on methodology, and Harvard's actually done something very similar. Regardless of our assumption that this would happen, it was still shocking and heartbreaking to see just how quickly the trajectory of COVID-19 cases have shifted right at low-income communities of color. And the thing is, it's still getting worse and worse every day. This is not a situation I'm speaking of the past. This is a situation I'm speaking about this week. And it's not abating. And I believe the protests, unfortunately, will exacerbate some of these things. So let's go ahead and look at the data. Go ahead and hit the next slide. So the data I'm about to show you is actually, we posted this up about, 4 or 5 weeks ago. You can find all of it at the URL below. It's interactive, it's animated. You can zoom into any of your areas and actually see the data played out there. And so you can check out the website there. The thing I'm also going to note, go ahead, next slide, that while the Investment Project California did the research and produced the site, it's all of these organizations, many embedded directly in the highest impact, high spike communities that helped us to frame up and then co-create the recommendations that I'll be presenting to you as well. The last thing I'll note is that this was first publicly presented to the Committee for Greater LA, which you'll hear about from Miguel Santana. And I also want to thank Miguel for his tremendous support and leadership to getting this out so quickly and having so much impact with it. So let's get into the data a little bit. Let's go to the next slide. So March 29th, the first few weeks of tracking COVID-19 cases, the more shaded areas are where we started to see higher caseloads. And as you can see, they sort of hug the coast, and our wealthier, wider neighborhoods are where we really started to see this sort of start to pop up. Okay, next slide. And then by mid-April, something had shifted, and it was parts of the southeast and the southwest of LA that started to light up. Bell, Cudahy, Southgate, those areas started to light up. Carson, Inglewood, so on and so forth. Those places started to light up on cases around April 17th. Next slide. By the end of April, beginning of May, it started to shift directly into South LA and big parts of the San Fernando Valley. You'll also see that bedroom communities like Lancaster and Palmdale, all the way up to Pomona, started to really pick up in terms of their caseloads by May 5th. And in the final slide, you'll see it really deepen by the beginning of June. And that was just 6 days ago, where we can actually see that really it may have started along the coast, but it really has embedded in places where you see higher concentrations of lower income Black and Latino community members. Okay, so next slide. We then analyze this by their actual, we compared all of the communities by how much poverty they have. The lighter blue line is where there are higher concentration of poverty versus the lower. And as you can see there on March 27th, it actually was about equal. You can't see it here because the caseloads have gotten so bad. But if you drill in, there were more cases in higher income areas in March. And then it starts to shift. But you have to note on April 19th, April 20th, April 19th, you see the trajectory shift in the blue line. So in high poverty areas, the trajectory shifted, and that's to about 14 days after shelter in place came into play. And so lower income communities started to see a massive spike on April 20th. And then note again on May 20th, a month later, I was hoping that plateau was going to start showing the decline. It did not. It actually showed a new incline difference on May 21st to go up yet again for lower income communities. Now, this would be the first time we've done this by race, so let's review by race. Next slide. For the Latinx community, that very much trails that poverty line that we saw. But you'll notice on March 27th, the blue line, where there are more Latinx communities, there are actually fewer cases there. And yes, that has a lot to do with the case loads or where the testing was inequitably offered at the beginning. But also, it shows that without that testing and that contact tracing, the Latino community shifted around April 4th in terms of caseloads being higher in Latino communities. And again, April 20th, trajectory shift. May 20th, trajectory shift again for Latinx community. Next slide. For the Black community, unfortunately, again, if you drill in, you can actually see that it started worse in the Black community in the very beginning on May 27. And then the gap between where there were more Black folks versus less, it just kept on growing and growing and growing. And I'm very, very worried that given the protest, that this will only be exacerbated. Okay, so we do see that the line shifts for the Black community, and the disparity keeps getting worse. Next slide. The only racial group that has been able to duck out of the way of this virus has been the white community. In communities where there are more white folks, you can actually see that they had higher caseloads at the beginning. And then by April 20th, when you saw everyone else have a trajectory shift, they were able to duck below and having where there are fewer cases where there are more white folks. And you actually see the blue line for the white communities kind of stay straight in terms of its growth, while the non-white keeps continuing to have a trajectory shift upward. Okay, next slide. Asian Americans, actually, they've trailed, they've had higher caseloads, and this sort of debunks the idea that this is a Chinese virus that our racist occupant in the White House has been pushing out there. There have been more cases in the Asian community, but not to the level, and it's sort of trailed along all throughout the last couple of months. And then the last slide on this. Okay, so actually, the one thing I want to note before I move to the top recommendations, we have data for the API and the indigenous community. Because the indigenous communities are so geographically spread out, you cannot see a differentiation, right? This is, again, another point of where the indigenous community has been erased because of data and because of genocide. And so if we're going to do something for the indigenous community, it cannot be geographic. It may need to go via community groups that speak and engage directly to the indigenous community. But I also want to note this. These are caseload data. We've been reading about the disparity in mortality, right, the death rate. And so if you compound the fact that there is a difference in death rates and that the cases have now shifted, we are talking about a massive disparity that's being created as we speak. And I'm telling you, it is not going away. I know there's a lot of fatigue around COVID, and we hear folks saying, okay, what's next? But this disparity is not going away. So we've produced these recommendations with those community partners, and here are the top recommendations that have gotten a lot of movement. A targeted surge in testing and contact tracing and high spike, high POC neighborhoods, and that we are currently mapping that with the DPH and DHS, and we are using cases, we are using poverty, and we are using race to map those out. And another top recommendation is that we need to test everybody returning from incarceration to these neighborhoods, okay? We are also talking about an air game. We needed targeted, culturally appropriate public education campaigns, content developed with and by trusted community leaders. And then we need a ground game because we need trusted community organizations, gang interventionists, labor partners that know these communities to be the bridge to this increased medical capacity. You cannot rush mobile labs into these areas and assume folks are going to feel that they can just walk into them, right? Places that have been linked to community partners, like St. John's, are oversubscribed by their testing. Places where you just put a mobile lab in a parking lot and you don't have community groups saying, hey, go to that mobile lab, it is safe, let's go and work there and get tested there, those have been undersubscribed. So you need a ground game to be that sort of trusted bridge. And the last thing is that community-based organizations also need to be trusted partners in their distribution of PPE, cleaning supplies directly into these communities. You know, I think it's important to say why the data looks the way it does. It looks this way because it's the way our economy works. Shelter in place only work for wealthier, wider communities, and unfortunately put Black, low-income Black and Latinx communities squarely in harm's way because they still have to get out there and work. I worry that reopening is going to exacerbate that, okay? It also happened this way because of the way racial segregation and gentrification work. You have intensive overcrowding and dense housing that Dr. Pastor showed. And so the typical response, if you're symptomatic, is go home and self-quarantine. I might be able to do that in my home in this office, and my kids and wife might be fine. But if there are multiple families in a single bedroom home, everybody there is going to get it. And then the last thing is it has everything to do with the way that trust works. Latinx communities do not trust government right now because of ICE raids, because of what this president's been putting out there. And unfortunately, we've been seeing a breaking down of trust in massive levels between government and the Black communities because of this other epidemic of police violence. And so in order to overcome the issues of the inequitable ways our economy works, our housing works, and our trust, which we need targeted approaches, and you need the grounding. You need the CBOs, because I'm sorry, you as government by yourself are not going to be able to pull it off and stop these surges. And so next and final slide for me. Next slide. This is what's happened since our release. There's been a cross-sectoral convening of county health departments, community clinics, and community and labor partners that have come together to actually flesh out the implementation plan of those recommendations. All of the health leaders have agreed wholeheartedly with our findings and recommendations, and we're now working together on how to implement it. The Board of Supervisors just passed a motion this morning confirming the county's commitment to the recommendation, and actually said that the CEO needed to work with the cross-sectoral convening to finalize the plan and to fully resource it. Okay, and the governor has been presented this report, has mentioned it multiple times. Their recovery task force, which Dr. Pastor sits on, has been discussing it, and we are now working with their Department of Health and Human Services to replicate the analysis at the state level and to collaborate on statewide findings. So that would be my presentation. Thank you.
Okay, members, I know Dr. Pastor has to get going in a bit, but I did want to open it up to the members. If you have any questions of him before he has to get off our Zoom call, I think, John, you can still stay with us. Is that correct? Okay. Members, Mr. Wesson, let's start with you.
Yeah, first let me thank John and Doc for this report. You know, for, I don't know, 3 or 4 weeks, I have been voicing, and a lot of my colleagues have joined in with me, concerns where it relates to reopening. But it just seems like no one is listening. And, you know, every couple of days, something else is being reopened. And trust me, I want to reopen in the worst way. Our people are dependent upon, the first people back to work when you reopen are going to be brown people and Black people, because most of the work that we do, you can't do that from a computer. So how do we get this message across? I think people kind of laughed at us when we were first doing this. So I am very concerned about this. I just want to get a back and forth with you guys with some solid recommendations, even though I love this report and we need this ammunition as we go out and talk. But I'd like for you to kind of address those concerns.
So first, I think those are very valid concerns, and they're very evident in the data. We just did a report with PolicyLink on who are the essential workers, and it's disproportionately Black and brown workers, particularly here in LA County. And then when you think about Councilman Wesson, not just the working conditions, but the fact that there's a reliance on public transit and people are going back to overcrowded housing, you're talking about very difficult conditions. I think one of the things, aside from the caution that you all will be using with regard to reopening, will be 2 things I would lift up, and I would be very interested in what John would say. One is to make sure that we have worker safety boards, that in the different industries that are coming back, including restaurant, that we actually involve the workers themselves in what do they consider to be safe conditions with regard to cleaning buildings, with regard to providing care, with regard to working in restaurants. We know that if the workers feel safe, then the consumers are going to feel safe, and that will lead the businesses to be successful. The other thing I think that's going to be really important, there's going to be a lot of temptation to cut back on public transit. But we really, these workers rely on public transit to be able to get to where they need to go. And so I think trying to think through those issues is going to be very important. Last thing, and I know that y'all have been leaders on this, is just to remember that data on what a large share of our neighbors are undocumented or have undocumented family members. So how do we make sure that whatever we're opening up in terms of resources is available to people regardless of status? Because unfortunately, particularly with what's going on in DC right now, we're not going to get the help we need from there to deal with our neighbors in a very effective way. So we're going to have to figure out how do we make sure everything we do at a local level is open. Because literally, and think about the interconnections in the districts that some of you represent. If you've got undocumented workers that are going broke, that's bad for small Black-owned businesses in those communities. So it's not just the workers themselves, it's the neighborhood economies that they impact.
So we have to be careful not to burden the responsibility of managing this global pandemic onto the victims of it. We have to be careful that our messaging is not about individual behavior of just Black and brown residents and workers, but that we're really messaging responsibility to the employers. And frankly, I went to a hardware store down the street and I had a list. I went in, got my stuff, got out. But as I did so, I noticed, I'll be pretty clear, a white family with their kids kind of perusing the aisles because they wanted to get out. And they were just perusing the aisles while the workers who were Black and Latino were stressed out that they had to be in those conditions and at risk. And we need to say, hey, we need to really push out messaging that all of us have to be worried about this, not just the Black and Latino community. The county's going to put out multi-million-dollar public education campaigns so that the employers and other institutions have to be responsible for PPE in their workplaces. And the last thing is, one of the recommendations is to get PPE into the communities themselves, right? And so when they come back to their communities, do they have cleaning supplies and PPE? These are hard to source, and we kind of want to get CBOs to be distribution points in the high spike areas. So we need to get them at work, we need to get them at home in the community, and we need to push the responsibility not just on them, but on all of us.
Okay, Mr. Price.
Chair, gentlemen, thanks for the presentation, eye-opening. It helped to illuminate what we all kind of felt, just didn't know figure-wise, so you're laying it out here. I'm especially concerned about the undocumented, as you suggested, Professor, overabundance in my district, especially. And so it's a matter of trying to communicate and trying to make sure we get the word out. I've been a one-note Johnny on testing. Let's talk about testing in terms of the big picture. I've heard some say, well, testing is not really that important. I think it is. How do we encourage folks to be tested, maybe 1 or 2 times before the actual immunization comes out? But how do we encourage folks to do that? And then lastly, on the charts, John, that you were sharing with us, you identify the communities, I guess, and you have downtown. I didn't see South LA per se. I see downtown. I guess that's including South LA and Southwest LA.
Yeah, so the data does show that in parts of South LA, there have been a heavy growth in cases. South LA, as well as Southeast LA and the East Side, have seen probably the heaviest growth. And so, unfortunately, all those areas are lit up. To your question about testing, there are a few things on the testing front that we're talking to DHS and DPH about. One is that we do need to get a better hold on who manages testing. I know the city had some sites, the state had some sites, the county has some, and all sites need to be linked to a medical home so that if you have a positive result, there's going to be someone that calls you and says, actually, to get treatment, you go here, here, and here, right? And not just say, hey, you're positive or negative, and then that's
good luck.
Yeah. Right? So that's one thing. The second thing is on testing, we need to complement that with contact tracing, right? So we need to say if there's a positive case, that there's contact tracers that then go to say, hey, you're actually in a home with 8 other people, and we test all of them as well. And then the last thing is, government right now is going to have a hard time getting into some of these neighborhoods because of the lack of trust or the trust gap. And so you need to have, like Janelle Bailey from the Black Workers Center, you need to have the community coalition, the Brotherhood Crusade, to say, hey, we will be your bridge to where you get tested and to link you to those places. And then lastly, we've had instances where LAPD is camped out in front of a testing site, and that's actually depressed numbers of people walking in. And so we need to coordinate with law enforcement to have the appropriate presence and not have over-presence in some of those places.
Thank you.
So two things super quick, one of which is something I think it's pretty low cost that you can do. But first I want to acknowledge, thank you that you said you knew this, but then we were the figure wise. We believe we are nerds for social justice, so we try to show up with data. But one thing you're absolutely accurate about 12% of the county workforce prior to this crisis was undocumented. But in South LA, it's more than a quarter. And in particular, in your part of South LA, Councilman Price, you've got a lot of, because of the movement of Latino immigrant households in there sort of 20 years ago, you've got an especially large number of those family households where you've got a lot of US-born kids and other family members with undocumented folks who are the maid wage earner, who may be facing difficulties hanging on to a job right now and are also, it's a real big stress for the family. One thing I've been talking about, it probably is a little bit easier to initiate at a local level, is to think about things like certification programs. I'll just give you an example. There's a lot of folks who are working at day labor sites, and people are concerned about picking up a worker at a day labor site. But what if you knew that that worker had been through a quick training about how to use a mask, how to use gloves, and how to be safe? How about home cleaners? Many of them are immigrants, many of them are undocumented. What if they'd been through a certification course where you knew as a homeowner that the person you're bringing in had been through some kind of certification and knew about the right kind of disinfectants to use, gloves, masks, etc.? That would yield to consumer confidence. And what about street vendors too? So there's a lot of little things like that. They're not really that costly, and they can help people get back to work and would actually bring in consumers.
Okay, Mr. O'Farrell?
Yes, thank you, Madam Chair, and thank you, gentlemen, for your reports and the data that you've collected. Just a couple of observations. I first want to thank you, as someone of Native American heritage, I want to thank you for your emphasis on the stats as it relates to the indigenous community, an often overlooked community that has some of the worst statistics down the line as it relates to health and well-being. And so I think it's going to be really important. And Mr. Kim, you nailed it in terms of there's not any one place where Native Americans can be found. It's a very, very disparate and spread out demographic throughout the county of Los Angeles. Allow me to be of assistance, since I've been working with the community now for many, many years. Also, in relation to density and close quarters and crowded living, I represent East Hollywood, which has some of the densest, most populated census tracts anywhere in the United States. So I saw in the map that it looks like East Hollywood was well represented in terms of the COVID-19 cases that have been proliferating lately, more late than early on. And I appreciate that in the report that will be generated, there is an emphasis on racial equity and a racial justice framework. As many of you know, because you participated, but I did a summit on poverty last September, and a report was generated and heard in my Homelessness and Poverty Committee back in March. And we actually approved a report, an initial report, with lots of data and statistics that back up both of the presentations that I just saw. And that'll be coming back to the committee this month. And that was disrupted by the COVID-19 pandemic. In fact, the council approved that report, the full council approved that report on March 17th, which was the last day we met before we had to go to Zoom and virtual meetings. So I look forward to having all of this information dovetail so that we can talk about real funding proposals to start addressing some of these fundamental inequities. Everything that comes before us is an opportunity. And when we can begin identifying where we want to fund and invest in some of these structural, I guess, disadvantages that we have that are affecting so many of the communities in Los Angeles, then we're really talking. So I look forward to the work that this committee does. I think it's going to be very enlightening. And then lastly, I'll just say this. I'm also glad, I think it was you, Dr. Pastor, who mentioned public transit and funding. I took public transit on Sunday, and believe me, the Metro buses, they are running extremely well, and there are, riders of every ethnicity, and social distancing and personal protections and face coverings were worn by almost everyone. So I think that's a really great point, that as we get more and more people back to work in the service sector, that we make it really widely known to our colleagues who deal in transit matters not to cut back on the availability of public transit. I think it's going to be really, really important. So thank you. Thank you, Madam President.
Thank you, Mr. O'Farrell. I want to give John an opportunity to respond.
Well, not so much a response, but just to close, at least from my end, a couple of things. If the city would like to engage in the cross-sectoral work group on how to implement the recommendations, we'd be happy to work with any of your offices on going deeper on the data and on the recommendations. And the last thing I'm going to note is that the same communities that are right now being ravaged by COVID-19 are the same ones that are burdened by the police violence question, are the same ones burdened by low counts on the census, the places where the superintendent can't find the kids and get them reconnected to schools, and that may have a hard time figuring out where to vote in these new conditions. And so I think we need to double down on that ground game conversation. An AmeriCorps type program, but for equity, a core that's focused on equity and that uses existing community organizers, promotores, gang interventionists. You have the people, they need jobs, and if we don't actually surge the ground game into these areas, we're going to let COVID-19 bake in new disparities in these communities for the next generation. And so that's a proposal that we're also working on, and the governor is interested, but I'd love to be able to work with the council on that as well.
All right, thank you. Mr. Cedillo, did you want to ask any questions at this time? No. I had a question for you two, both of you gentlemen. I know that CARES Act money seems like it's a lot of money, but it really isn't to deliver all the aid that we would like to through this committee. So I'm wondering, what should this committee be focused on when it comes to its recovery efforts? Should we be using geography, socioeconomic background, race, or other factors to determine where to target this, where the targeted aid should be focused in?
Yeah, I'll say a couple things. Well, first, all of us should be fighting for the HEROES Act so that there's a sufficient amount of money that comes, particularly to state and local government. Right. And it's quite criminal and negligent on the part of the president in particular, but Congress in general, if that's not delivered, because the brunt of all these expenses have been falling on state and local government. And you know this already, but neither California nor Los Angeles was being fiscally irresponsible prior to this crisis. So I think that case needs to get made, because we often get portrayed as though we're sort of some lefty loonies who were spending money rather than generating more jobs than anybody else in the United States and running budget surpluses. The second thing I would say is that I would, in terms of targeting, do a careful economic analysis about what sectors are losing lots of employment opportunities. And that's why I lifted up this issue of high tech and finance versus leisure and hospitality. Helps you think about sort of who's really going to need the employment. Last thing I'll say is that I would beseech so many of you to think about the populations that are the most likely to be left behind. I've certainly lifted up the issue of undocumented Angelenos. Glad to hear that come up from some of the council folks as well. But the other population I'm deeply worried about is people re-entering from the incarceration system. Trying to get a job when there's 4% unemployment, if you've got a record, is different than trying to get a job when there's 20% unemployment. And yet we know that unless those folks are able to get back on the right track in terms of employment, jobs, income, housing stability, et cetera, so that we are really going to face long-term problems moving on. Certainly they will, and communities will as well. So I would, for all of us to think about who's the most likely to get forgotten about, and therefore who do we need to lift up in terms of our efforts.
So, Council President is correct. That $700 billion from CARES is going to go quick. And, you know, we were also one of the signees of the letter that you all received last week about the investments that need to be made specifically in Black communities, given the police violence crisis. But there are ways that these things can dovetail to one another, but it's still not going to be enough money. So the council, I would beseech you all to consider publicly endorsing schools and communities first as one of our only opportunities to get real dollars down to cities, you know, and year by year. In terms of where money should go that you do have, we do think that maybe partnering with the county on building out this surge capacity on the medical and ground game in high spike areas would be critical. I would ask that the city does not create its own infrastructure, but work with DHS and DPH and flow the dollars through there, because you can't put testing and contact tracing out distinct from the health system where they need to be linked to medical homes. And I would also say that given the point about census and voting and what have you, I would again just lift up this idea of an equity core, a jobs program focused on high need areas, high spike areas that you can use now for COVID, but for schools and for voting and for all other issues that are coming up. And so those, I think, would align with the letter that we all submitted last week, but also deal with the COVID crisis, because unfortunately, the crisis of public health and crisis in public trust are intertwined, and we need to think strategically about how to work on those together.
I'm going to have to dash, but thanks for letting us offer this information to you. That was really great. I'd say the only awkward thing is some of you I've known, Gil, I've known for at least 3 decades. So the idea of calling all of you council person X instead of just Herb and Kern and Murray and Gil, it's a little awkward, but you know, I know you're trying to make sure that we can all respond and make for a better, more inclusive, and more sustainable Los Angeles.
Thank you, Manuel, but I will always be Nuri. So you can always call me Nuri. In fact, that's what I would prefer. Mr. Weston, did you have any additional questions? Because Mr. Manuel needs to step away.
I know Manuel's got a job to do, and I like Nuri. I tell everybody, call me Herb. That's, you know, councilman is what I do. Herb is who I am. But I have a question, because I agree we need to creatively do everything that we can to make sure we get more federal aid, and we should support the HEROES Act and all of that. But I don't think our voices as California or LA really makes a difference with the White House. But my question is, even though most of your work is in LA region and in the state, do you guys communicate with other states, other jurisdictions? Because even though there are some demographic differences, I think if we could make a case that this is a national, where it is affecting undocumented workers, you know, from New York to California, where it is affecting individuals who are incarcerated from Washington to Florida, and African-American people. You've got indigenous people all over the United States of America, Latinx. So do we think these statistics are national? And does it make sense to try to come up with some kind of a national map that could help our federal electeds or what have you?
I'll answer it quickly and then jump to the next thing I'm late for, which I think it's a very good point. And I think so we've been doing some stuff with DC-based groups that have representatives in different states. Illinois has got a very similar set of issues with regard to racial disparities in immigrant communities. I think it's really important to think about the Floridas, Georgias,
Yes.
Texases, and Arizonas. That is those parts of the country that are also facing these kind of vulnerabilities, but that have tended to vote red and therefore might get more bipartisan. They'll be critical to a bipartisan consensus about what we need to do. You look at the data on racial disparities in terms of COVID cases and COVID deaths, and there's a very consistent pattern with Black and brown folks, and in Navajo Nation, where there is a concentration of Native Americans, and therefore you can really see it kind of pop up. So it's a very good point, and all that means is that unfortunately John and I have to do more work.
So just, John, what are your thoughts?
So actually, it would be nearly impossible to pull together a national map on this because the data all comes from local public health departments or up to states. What we have been doing is sharing our methodology so that other people can build this out in their own areas. And Congressmember Bass, when I presented this to her, she also was wondering if we could map this out for other places. We're going to first push for the entire state to do something like this, and we're pushing Dr. Ghali at the state level. But if anybody in any other jurisdiction has an interest in this, our methodology we're putting out there, and they could actually replicate this fairly quickly, and we can support them on that. But being able to do it from one shop, I think, will be nearly impossible.
Okay.
Okay, are there any other questions, members? Okay, thank you, gentlemen. Thank you, John. I know Manuel had to go. Appreciate all your support and help with this. We will connect soon through our offices to continue to do the good work and figure out how to reinvest in our communities. And we'll have you back, John.
Okay,
so if you're available, we'll have you back in the near future. Thank you. Okay, let's move on to item number 1. Can you go ahead and read that into the record, please?
Yes, Madam Chair. Item number 1 is a presentation by the Committee for Greater LA on the work of the group and updates on the COVID-19 recovery report that will be developed.
Okay, we have Miguel Santana. Welcome, sir. Nice to see you. You're muted. We can't hear you. Unmute yourself.
It's good seeing all of you. Boy, this is weird, I have to say.
I don't think I've ever seen you with a beard.
I'm sorry?
I don't think I've ever seen you growing a beard before.
It's good seeing you, Council President, and I've been listening in to the presentation. Thank you for giving me the opportunity to present on the committee. What you heard earlier today was one of the sessions that the Committee for Greater LA had, at the beginning of this process. What I'm here for is to provide a little bit of context as to the origins of the committee, its purpose, and what our roadmap is moving forward, and to solicit your input and your ideas about issues that you would like to ensure that the report includes. So at the beginning of the crisis, our philanthropic leaders here in Southern California decided to come together to identify the systemic issues that the COVID-19 was exposing. And they did this by deciding to bring together a group of civic leaders from the broader Los Angeles County region and partnered with UCLA and USC to provide the academic research support being spearheaded by the committee itself. I was asked to chair the committee. Joining me, of course, is representatives from both the council president and the mayor, as well as the chair and chair pro tem of the board of supervisors. We also have members from business, including Raul Anaya, who's the president of Bank of America, representatives from community-based organizations in throughout the county, including Long Beach and South Los Angeles, representation from labor, as well as those in specific areas of housing. The way we structure our work is that every week we take on a topic where the member of the steering committee provides direction to our academic partners to do a deep dive on some of the issues that are surfacing during this crisis. So far we've discussed everything from homelessness, housing. You just heard a presentation about how COVID-19 is developing in communities of color. We had a presentation on the impact to the economy and employment, even the impact on the census. Moving forward, we're having a discussion on the broader African-American experience here in Los Angeles, as well as the impacts on health, mental health, and education. The agenda that we have is very aggressive. Our goal is to provide a comprehensive report on each one of those topics by midsummer, and to focus on the systemic issues that the crisis has really exposed. I think that, as you heard in the report, there really are two Los Angeles. The one that is sort of often displayed in the mainstream media, and then the one in Los Angeles where the majority of people, mainly people of color, are experiencing day to day. And it's illustrated in just how we talk about COVID and the bending of the curve. You know, at the time that there was a bigger discussion about the curve starting to be controlled here in Los Angeles, it was actually beginning to grow in communities of color, as you saw by Manuel and John's presentation. Our recommendations are not intended to be limited by the current realities. They are intended to be far-reaching, to be global, to present in a long-term and greater vision for the Los Angeles region, one that is more equitable, one that is where the impacts of these kind of issues don't disproportionately impact communities of color. And we're relying heavily on data to tell this story. As you saw today in this presentation, the numbers speak for themselves. And the reality is that the same story could be told in the area of housing, in the area of employment and education, access to healthcare, and other significant issues. The last thing I'll say, and then I'll be happy to answer any questions and certainly want to hear your input, is that the one area or the one issue that has clearly surfaced, not a surprise, is that ultimately these systemic issues don't fall under the responsibility of one single level of government. That oftentimes these issues are about the intersection of where the city and the county connect, where the county connects with other communities, where the county and the state and the federal government connect in alignment of resources and initiatives. And so our intention is to be clear about those intersections, where there needs to be systemic change coming from the federal government and how it trickles down to the state and county and city level. And also talk about the role of philanthropy in the private sector in being responsive to those issues. And so in many ways, the crisis sparked the conversation and the interest to begin this analysis and this work. But what is really driving the perspective and the final recommendations that are being developed is really the current conversation that's taking place of the issue of race and how race plays a significant factor in what the experience is like for Angelenos every day. And so we are working towards a broader vision for this community that will hopefully get us through the next crisis. So with that, I'll be happy to answer any questions and certainly interested in getting your thoughts.
Members, are there any questions of Mr. Santana? So I had a few, Miguel. So what is the plan to keep the philanthropy and private sector engaged after the report is released?
So that's an important question because we are beginning to talk about what happens after the release of the report. I think there is significant interest from philanthropy to continue to invest in this work. Fortunately, enough money was raised to not only cover the technical aspects of the research that's being done by our academic partners, but also to help establish a plan moving forward. So, we think that it's important that this work have a life after the report is released, so it's just not simply another report that gets shelved. Part of our final work product will discuss sort of the next steps after it's final.
And so when is the date? When do you plan to release the report?
So we hope to release it by midsummer, so no later than mid-August, probably sometime between mid-July and mid-August.
And so the other question I had, what is the committee doing to ensure that the recommendations in the report are things that can be implemented? Because like you said, you just don't want to issue another report that just gets shelved for years and years and years. And it's important for us to figure out that the work doesn't get lost, but that there's actual ways to implement some of the work.
So what we want to make sure is that we are clear in assigning responsibilities. So for those areas that we believe the city has direct jurisdiction and responsibility, we want to make sure that we've identified areas in which the city could change its policy directives, its funding priorities, its future planning, and the same for the county. And I think one of the specific conversations that are happening with philanthropy is informing their support for organizations whose job it is, like what you just heard from the Advancement Project, to advance these issues even after the report is released. And in many ways, philanthropy helps spark this conversation and made this investment on behalf of the community, and it's really intended to be a work product for the community that they could then proceed and advocate for. But I think the important thing here is that there is, there's obviously a conversation today about racial equity and systemic racism. And, until you see these data points, until you actually understand the real impact it has in an aggregate way to specific communities, they're just kind of buzzwords. What we're hoping to do is make it real and establish a sense of benchmarks that you could evaluate on a regular basis to determine what progress we're making as a broader community.
Mr. Cedillo, did you have anything? Do you have a question?
Yes. So great to see you.
Good seeing you.
Obviously, you're a special person. Can you hear me, Madam Chair?
Yes, we can hear you.
Okay.
Miguel's
So,
a special person.
Mr. Santana, you're a very special person because you have led two major organizations, the County of Los Angeles and the City of Los Angeles. Many of the challenges we have, both responding to the epidemic COVID-19, but also the challenges with police abuse and the appropriate role of police in our society, is frustrated by, sometimes exacerbated by the fact that we have two agencies that don't interface routinely or structurally. And so my question is, so what do you see as the likelihoods for realignment in this area? For example, we charged our Los Angeles Police Department with doing testing. So they did testing for half the county of Los Angeles. Now there's a desire to limit and restrict the role of the police department and make it strictly, I guess, policing and security, no longer public health, or mental health, homelessness. What are your thoughts, having worked in two leadership positions of both agencies, of the likelihood of realignment, and what would that realignment look like? How do we transcend that? I know Mr. Wesson will take these recommendations when he goes over to the county as a supervisor shortly, but in the interim, what does this realignment look like? How would you envision us being more efficient and effective, given that we represent about 4 million of the close to 11 million residents of the County of Los Angeles?
You know, I think the most important thing that our report could do is identify opportunities for alignment, as you said, and for coordinated accountability. So the issue of homelessness and testing are two good examples that you raise, where it's not clear who's actually in charge of those issues. It's the intersection between the county and the cities, where there often is overlapping jurisdiction and many times competing or differential policy objectives and directives. And one thing that is certain is that prior to COVID, as you this was the best system that we could produce. And it wasn't that long ago that all levels of government were actually experiencing unprecedented surpluses. There was an unprecedented investment in homelessness. There was a lot of optimism that was fueled by a robust economy. And but yet the outcomes that you just saw in the report that John and Manuel presented, and the kind of data points that we are receiving as a committee, shows that on a systemic level, people were being left behind, and it wasn't the experience for many, in most cases, majority of Angelenos. And so ultimately, what is required is an entire sort of overhaul of the system, where we actually assign some accountability and focus on whose responsibility is in the area of homelessness, as an example, or in the area of delivering a healthcare system. What are the resources required to achieve a certain level of outcomes, and what supporting role do the other agencies play, as opposed to sort of the ad hoc way in which we do things now, where it's often driven by initiative or special projects or individual leadership. And that's when I talk about looking at things systemically, that's sort of what I'm referring to, is taking a step back and saying, what is failing here, and not to blame anybody, but to simply provide an opportunity for a different path.
Would you think, in terms of visualizing this, that there's some entity like the MTA, for example, seems to fit into what you just said? A specific charge, a collaborative governance structure, some degrees of accountability. Does that kind of meet the kind of vision that you laid out?
So I think the issue of governance is something that I think we will talk about in our report. The challenges of the current decentralized system that we have and the opportunities of having it centralized. And we will discuss alternative options. Certainly that the idea of an MTA type structure is an option that could be considered and pursued. The important thing is to acknowledge that the current system is not working, right? Start with that consensus and to challenge ourselves to be less jurisdictional and concerned about our individual role, but rather present an alternative approach that is outcome driven. That, you know, the current opportunity that exists, for example, with Operation Roomkey, there is, you know, it was an unprecedented movement to house thousands of people who had been experiencing homelessness. That the fact that we were able to move so quickly is it really signals what happens when there's coordination. The challenge is what happens after that, and simply relying on a system that is decentralized with diffuse accountability and lack of clarity as to even what funding streams support these efforts won't get us to the ultimate goal of significantly reducing the homeless population. So yes, the question that you raise about governance will be part of what we will be presenting.
Okay, Mr. Price.
Madam President, Miguel, good to see you again.
Nice seeing you.
Not surprised that you are in the hot seat, because you seem to wear that well. Just a question, though, about our philanthropic community. I know they've been a part of your discussions. Have they indicated a way, a thought of doing something differently? You know, creating a single fund or putting into a single fund to try to impact this, or is it still going to be kind of one-off, every kind of a non-profit philanthropic organization sort of doing their own thing based on their own silos? Have they been talking about doing things different?
I would say yes, and it didn't start with this particular crisis. I think we don't, because we operate in Los Angeles, I don't think we appreciate always that in this community, philanthropy is more coordinated than most communities, and they often program together. They are in constant communication. They share data. They share objectives, and they collaborate in supporting big initiatives. You know, the experience of Triple H is a good example of that, where philanthropy came together around that support. I think that part of our responsibility as a committee, because philanthropy supported this effort in 100%, is to be clear about what their role is in all of this, and how can they streamline their processes, how can they establish a common set of objectives that are both short-term and long-term, and how can they provide a level of continuity in the support of this work to ensure that it's not just another effort that gets shelved and is later written about as another failure in Los Angeles. And so, you know, I think they're certainly focused and speaking to that effort now, and we have a responsibility as a committee to provide them specific recommendations.
Thank you.
Councilman.
Okay, thank you, Miguel. It was good to see you. Members, I'm going to offer a recommendation on this item. I want to request that a representative from the Greater LA Steering Committee come back to the ad hoc committee once the report is released. Okay? Any objections? Seeing none. Thank you, Miguel.
Thank you.
Okay, let's move
President,
on.
when will that be? When do we expect to report back?
Mid-summer. Miguel indicated mid-summer, anywhere between mid-July to mid-August. Is that what I understood, Miguel?
That's correct.
Thank you.
Thank you.
Thank you. Why don't we go ahead and move on to item number 3? You want to go ahead and read that into the record?
Okay. Item number 3 is Chief Legislative Analyst and City Administrative Officer Joint Report and CAO Report relative to the fiscal impact of the COVID-19 pandemic on the city's budget and discussion of future action in response to the pandemic.
Thank you. And with us, we have Patty Huber from the CAO's office. Patty, do you want to get to the center? It's just easier for folks that are watching us. There we go. You can both be on each end. Yeah, you can stay there, Matt. And you will go ahead and give us a breakdown of the city's spending in response to the COVID-19 pandemic. Do you want to go ahead and get started? And we also are joined by Matt Zabel, the mayor's deputy chief of staff, here to answer any questions as well. Go ahead, Patty. I think your mic is not working. Can we do a mic check for her?
Hello. Okay. Good afternoon. In front of you is a CAO report that it is recommended for receiving and filing as it's for information only. It reports on the short and long-term fiscal impacts of our COVID-19 response on the city's budget. In developing this report, we did work with the mayor's office, given their key role in developing and managing the city's response efforts. Additionally, projections are based on amounts, in some cases reported by departments, that have not necessarily been fully validated by our office or have supporting documentation such as timesheets and invoices. That is work that will be ongoing. Much of the city's activities that are included in the attached charts are anticipated to be FEMA reimbursable at 75% of documented costs that we have to do it before we will get full payment. At this time, the city is anticipating that it will need to fully fund the 25% cost share. Even though historically in other emergency events, the state has reimbursed 75% of that 25%, or 18.25. But at this time, the state has notified both the city and other jurisdictions that the decision to reimburse a portion of the FEMA match is just going to be determined at a later date. We just don't know what they'll say. We do continue to monitor this, but for now in our projections, we have made the assumption that the coronavirus relief funds from the CARES Act will fund those costs. Overall, based on current projections, it's anticipated that the city could expend in the neighborhood of $256 million by June 30th and $548 million by the end of the calendar year. It should be important to note that the calendar year number includes the June 30 number, and many of the programs have assumed end dates of differing times that are noted in the report. For the year-end report, it's just, we would note that if they're not realized as assumed in terms of the projections, that number will change just depending on how things actually happen during the month of June. A key example really is Project Room Key, which is continuing to add rooms on a regular basis, but may or may not do so to the assumed schedule. So of that 256, we would say that approximately 113 million is FEMA eligible. We would note that there are some things that we have added since our last report that were not in there and that are not FEMA eligible. And those are the COVID admin leaves for both council-controlled and proprietary departments. For council-controlled, we're looking at approximately $25 million by June 30 for employees who are on leave because they are unable to do their current job, either because telecommuting is not an option, because they're quarantined, or what have you, but that is in accordance with mayor and council policy. For the council control, or for the proprietary departments, that's another 10, almost $11 million by June. And at this point, the departments are just absorbing those costs. We would also note that there are efforts underway to develop a contact tracing program, and that is expected to heavily utilize our disaster service workers, which are city employees who are then deployed to do these work. There is no cost estimate available at this time, but that is expected to be a fairly significant effort, impacting us into the new fiscal year. And at this point, I'll take any questions that you might have.
Members, are there any questions of Patty and Matt? If not, I have a few, but okay, seeing none, I have a couple of questions. Maybe to you, Matt. What's the plan for the child care centers for hospital workers and first responders after August? Because according to the report, there's another 20 child care centers coming on board at the end of June. Are we at capacity at the other 20 sites? So there's two questions in one.
Sure.
Yeah.
So currently, Madam President, we are taking registration for the first 18 currently. We plan to have 43 sites open by the end of June, and funding, the proposal would be that the sites are available through the end of August, but if we wanted to continue that, additional funding would need to be identified. Also, at the sites that are being utilized, they are mostly rec centers. There will be some libraries. There is a proposal for the zoo to be used as well for childcare, so there would have to be considerations with impacts to the uses of those facilities. But the program should be completely up and running by the end of June, and it would be up to the council how long you want to continue that program.
And have we reached capacity at the other 20 sites?
We haven't reached capacity at any site yet.
Okay.
We're only taking registration for the first facilities currently.
Okay.
And we would note that that is another area that is not FEMA eligible.
That is not FEMA eligible.
It is not eligible for FEMA reimbursement, no ma'am.
Okay, other questions I had regarding the report. Do we know how many hospital workers and first responders we are currently serving? Do we have those numbers?
I don't have those numbers now, no. We will have a better idea once we complete the first round of the registration process.
And how about how many seniors have been served through our senior meal program?
For the senior meal program, let me pull that out. Oops. So there are two programs. I do not have a complete total because it depends on, so there's the program that is through our Department of Aging, which is currently serving over 20,000 seniors a day. It's 10 meals per week. There is also a program through Every Table, which is 10 weeks of meals for 9,600 seniors. I don't have a complete count on that as of now because it depends on, the 10 weeks starts when the senior signs up, so there's a cascading effect. But as of now, we are serving 20,320 seniors every day.
And it's also my understanding that the county has about $300 million for testing. Do we plan on transitioning the testing sites to them or having them pay for the sites moving forward? Do we have a plan?
We do, and we've been working with the county we've been working with the county closely since this crisis started. But as it related to testing, and as you know, testing is an area that would traditionally be in the area of the Department of Health Services from the county. The mayor made a decision that given the importance of making testing available to the community when there was very, very little testing available to the public, that we would stand up a program, front fund the money, and then do what we could to get reimbursed, either through FEMA or other sources. Currently, Madam President, we are serving, or we are making available more than 15,000 tests. We understand that that is not sustainable, and that we are in conversations with the county, given that the county has the resources, and they are pushing out those resources, not just to county sites. The county isn't doing the traditional drive-through sites that you're familiar with, but they are they're pushing testing out through community clinics and other sites. So currently they have 70 sites available for testing. The mayor would propose, and as we're working with them, a gradual wind down of testing. As I said, we are currently at 15,800 tests per day, every day except for Sunday. We would, by July 6th, take that down to 5,200 city-funded tests. By August 31st, 2,750 city-funded tests, and then take it down to a minimum level of 500 tests by the end of October. The mayor does feel that it is important that the city maintain a minimum level of testing so that we can ensure, for equity purposes, that there's testing available in neighborhoods that may not have it available through county resources. That would be important for us to keep at least that minimum level through the end of the calendar year. Those numbers, by the way, Madam President, are in addition to the 500 tests that we are also funding through our partnership with UPS that serves specifically the skilled nursing facilities in the city of LA. So we would continue that 500 per day for skilled nursing facilities, and then commence with a gradual wind down as the county ramps up its testing program between now and the end of October.
So how are we, I'm sorry, did you want to add something, Patty?
I just would like to note that the decision to go into October is one that I was communicated to me today. So our report still reflects what we originally thought was an August wind down of testing.
Okay. So it doesn't reflect the new October date?
And so it's not reflected in the numbers in the attachment because I found that out today.
Duly noted, great. So how are we preparing for the next wave? The data shows that cases continue to go up, particularly in communities of color. So how are we adapting the testing program to meet those needs, especially where we're seeing our numbers continuing to go up?
So that's a very good question. As it relates to the position of the mayor, we need to be flexible. If we are, now we're facing trends that are upticking, as you said, in new deaths, in new positives, in new hospitalizations. Those are all in bed capacity is declining. Those indicators are moving in the wrong direction, and that is, of course, before we may face a second wave that had been predicted as potentially happening anyway. And then on top of that, if there is any impact of the demonstrations that may increase the spread, we feel we need to remain flexible. But our hope is, now that the county has ramped up its testing program and is making more tests available than were made available to the public when the crisis started, that we would hope that they would ramp up consistent with the need. But the city, our view is this is an emergency, this is a crisis, and if there's a need, the city needs to be ready to meet that need, given that these are literally life and death situations we're dealing with.
And if FEMA reimbursement is delayed, are we going to have to fund the entire amount through the CARES Act? How do you see that playing out?
Well, I would say, I'm sorry, I'll let Patty answer, go ahead.
That is a difficult question. We are in the process.
That is the question.
It is the question, and it is a difficult one. We are coming into a new fiscal year. So departments will have new appropriations and can use some of that to cover some of these costs. But that does come at the cost of they're not doing other things, right? Those are funds that are budgeted to do things that this council and mayor have directed we want you to do, and they're being diverted. We are continuing to push, and the mayor's office has been very generous in helping to provide us additional resources, because I really only have one person who knows how to do FEMA applications. We have submitted some expedited funding requests, which would give us up to 50% of the 75% for the Surge Hospital, for the Rec and Parks congregate shelters, for the test sites, and for senior meals. I will say the first one that we did, the Surge Hospital, was in sort of late April, early May. We still don't have that money. The testing one just went in a few weeks ago. The senior meals went in like yesterday. The shelters at the Rec and Park sites was denied. We're working to get them additional information, so hopefully they will revisit that decision. Getting the funding up front will help with cash flow, but that last portion of the 75%, that is going to be a long term, and it's going to take a while, because they're going to do a full accounting of all of our expenditures once they sort of call an end to the emergency and we're no longer really incurring expenditures. They generally do an audit. We have to provide all the payroll documentation and timesheets. We have to provide all the invoices for all of the expenditures that we made. We have to show that the equipment that we said we used had a body attached to it. So again, going back to payroll. And it's just a long process. And again, I have only one person who really does this full time. And then it's also subject to FEMA's, their timelines for doing their documentation and their reviews and so on. So we are very hopeful of getting the expedited funding to start helping to deal with the cash flow, but we still don't have an update on when we're going to get those. Our testing application has not yet been approved. It has been submitted, but it has not yet been approved. And as I said, for the Surge Hospital, which was approximately $7 million, we still don't have funds. And we would only get 25% of that, or 50% of that amount.
So my last question before I know members are on the queue, have we reached out to the state to see if they would provide that 18% reimbursement? Has that conversation taken place yet?
The conversation has taken place, and the answer has just been they haven't decided.
They haven't decided. So we haven't heard a definite answer yet.
No. Okay. The only thing I could note is that the May revise from the governor actually added additional funds to that line. It's the CCDA, California something Disaster Assistance. I apologize, I don't remember the full acronym. Of course, I don't know what the legislature will do with the mayor's or with the governor's May revise. So we'll see if that stays.
All right, thank you. Mr. Cedillo?
Can you hear me?
Yes, we can hear you.
Thank you. So first of all, I want to, obviously commend the mayor for his incredible leadership when this pandemic hit us, and we have gone beyond duty to meet the call. But we have also maxed out our limit, our capacity. And so obviously we have great concern for us to be reimbursed for those extraordinary costs, whether it be from the county or from the state or from the feds. Let me suggest that there may be a need, if you only have one person working for you, that then there may be a need for your department to hire more people, because this has to be staffed at the level of its importance to the city and the residents of this of the city. And if we're not getting our reimbursements, it's going to be difficult for us to continue to provide the critical services that the city will have to throughout the next immediate period. And so how can we help you get more staff? And then what are our strategies for the May revise? We have a very robust delegation in Los Angeles. We have people who have incredible skills and capacity in the legislature. How do we make sure that they are leading the charge for Los Angeles to get its reimbursement and get the fiscal and financial recognition for the leadership it provided at the beginning of this pandemic?
So relative to staffing, as I noted, the mayor's office has very generously let some of their grant specialists help us, and so they are actively working to help us get all of our expedited funding applications put together so that we can turn those in. We are looking at how we can leverage resources in the office to see if we can have our budget analysts potentially help us do more with the documentation components of it. That is a challenging issue, however, as we are also looking at a year when we may be revisiting the budget on a fairly regular basis throughout the year, because it just becomes a resource issue. And our budget was reduced, as were others, and we will be facing furloughs, as will others. That's just, we're just going to have to manage to the very best of our abilities, and we're looking at ways to do that.
Mr. Price?
I certainly just want to thank the mayor for his extraordinary leadership. His team has really been responsive, and we all are sort of working this as we go. I just appreciate the effort. Question about the hospital surge. I know that we had set up the convention center in my district to prepare as a surge facility. Did not occur, I don't think. So the question is, can we still use that facility, or is this going to be closed down, or what's the plan for additional uses there?
So right now, Councilman, the relief facility is in standby status, and it is our hope, given the uncertainty of the immediate future and what we might face in the fall, that given that the convention center may not be used as a convention center until that time, that it would be our recommendation that the 250 beds remain in standby status until the end of December.
Okay, great. I would encourage that as well. Question about the emergency shelters at our parks, and do we have an end date on that? Is that also end of August, end of the year? Do we have a working number of how long we plan for them to be up and operational?
The assumptions for the recreation and park shelters is through September, the end of September, but obviously we have the federal lawsuit on our homeless response, and so those shelters, along with Project Room Key and so on, those are all just, we are waiting for whatever that will be to inform our ongoing efforts in those areas.
Councilman, we have begun this week a demobilization of some of the rec centers. As Patty said, the plan is that they will all be demobilized by the end of September, but we are beginning the process of consolidating. We have, as of the beginning of June, stopped the intake process. So as the shelters thin out, we'll begin consolidating them towards a completion date of September 30.
Thank you.
Members, are there any other questions? Patty or Matt? Seeing none, I'm going to go ahead and recommend and instruct the CAO to provide the ad hoc committee with a monthly expense report on the COVID response spending. And I just want to make sure that we ensure that this committee is updated on a regular basis, so that we can provide input on how much money is being spent, so that we know how much funds are available to ultimately help communities recover from this public health and economic crisis. Okay? Any other questions, members? We can go ahead and receive and file the current CO report. Are there any objections? Okay, seeing none, that will be the order. Seeing no other further questions, I will go ahead and adjourn this ad hoc committee. Thank you.
Madam Chair, would you like me to call the roll for the vote, for the action for item 13?
Sure.
Yeah. Okay. So it's the intent of the committee to receive and file the joint CLA and CO report and the June and
Our ad hoc committee is adjourned. Thank you. Thank you, members.